Alaikum. My name is Maryam Fatma, roll number BP1650128 in group number 18, and my topic name is Ischemic heart disease. So first of all, we will describe what ischemic heart disease is. We'll look into the definition. Ischemic heart disease, also known as coronary heart disease, occurs when the blood flow to the heart muscle is reduced because of a partial or complete blockage of the artery supplying it with blood. Ischemic heart disease is a very common illness that affects a large part of the population. Ischemic heart disease is caused by arteriosclerosis. It is a chronic inflammation of arteries which causes them to harden and accumulate cholesterol plaques on their wall. If it occurs in arteries that carry blood to the brain, then it may cause a stroke. If it occurs in the artery supplying blood to the legs, then it could translate into pain when walking. If it happens in arteries that deliver blood to the heart itself, it may cause angina, chest pain. We'll look into the symptoms of ischemic heart disease. In the event of a coronary blockage, the cells forming the heart muscle suffer a reduced oxygen and nutrient supply, which manifests as chest pain. Chest pain is the pain that usually characterizes ischemic heart disease, is described as tightness in the chest which can occasionally radiate to the base of the neck, the jaw, arms or back. Second is shortness of breath. The heart becomes weaker and can no longer pump blood towards the rest of the body. Palpitation. Patients notice a strong or offbeat heartbeat in their chest, which could be secondary to an arrhythmia. Sweating or nausea and vomiting. These symptoms may all appear together or individually. In reality, they are caused by the body's response, specifically that of the nervous system, to the heart muscles, ischemia, which represents a serious injury. Loss of consciousness. Loss of consciousness is due to the problems with the heart's electrical conduction or presence of severe arrhythmias, because it loses all capacity to pump blood. If you notice any discomfort in your chest, even if it is not one of the typical symptoms described above, then you should visit your doctor as soon as possible. Now we will see what are the treatments of ischemic heart disease. Once the patient has been diagnosed with acute coronary syndrome, then they should remain in hospital and rest. If the patient infarction is due to the total blockage of coronary artery, then treatment aims to block the artery as quickly as possible since every minute counts. Medicines used during the acute phase are acetyl salicylic acid, which is usually called aspirin, which stops the platelets from aggregating and sticking together inside the artery and therefore reduces the chances of thrombus formation. Anticoagulants. By means of a different mechanism, these also aim to dissolve any thrombi inside the artery. Different types of heparin are used and may be administered by either intravenous or subcutaneous injection. Other platelet aggregation inhibitors. These reinforce the action of acetyl salicylic acid as they also prevent platelet aggregation. The most common one is clopidogrel. Beta blocker. They work by slowing down the patient's heart rate so it is in more restful state and demands less oxygen. They also reduce the risk of arrhythmias. Pain relieving medicines. In several cases, patient may require morphine if the pain is very intense. Nitroglycerin can be administered as a tablet, sprayed underneath the tongue, or by intravenous injections. It is used to dilate the heart's arteries, allowing more blood to flow through them. Thrombolytic or fibrinolytic agent. In cases where a thrombus is completely blocking an artery, these drugs can be administered in order to break the clot down and thin the blood. In certain severe conditions, when medicine is insufficient, when medicine is not affecting the patient, then the surgery treatment is done. Surgery treatment include angioplasty or percutaneous coronary revascularization. The first step is to take a coronary angiogram or perform a coronary catheterization. If any artery is suspected of being totally blocked, then the catheterization must be performed urgently and without hesitation. Coronary angiograph will reveal which artery or arteries are affected, using the catheter that has already been introduced at the patient's groin or wrist. Second is coronary revascularization or heart bypass surgery. Sometimes more than one coronary artery is blocked, or there are multiple lesions which are difficult to treat with an angioplasty. An alternative solution for such cases is to perform heart bypass surgery. It is performed in an operating theater under general anesthetic. The surgeon will open the sternum to allow good access to the heart. The bloodstream is sent to a heart-lung machine. This acts as an artificial heart and maintains the blood supply to all of the body's organs while the heart is treated. Now, long-term treatment. Lifestyle modifications are needed for long-term treatment to avoid or prevent ischemic heart disease. It includes stop smoking, eat a balanced diet, exercise regularly, control the risk factor. Drug therapy. Patients with ischemic heart disease must take a combination of drugs to reduce the heart's oxygen consumption, dilate the coronary arteries, and prevent the formation of a new blockage. It includes nitroglycerin and its derivatives, nitrates, either as tablets or transdermal patches. These drugs are known as vasodilators. They relax the arteries and veins, including the coronary vessels, thereby increasing the blood flow in the affected area and eliminating the chest pain from angina. We will discuss the angina and chest pain later. Beta blockers, bisoprolol, carvedilol, nebivolol, metoprolol, atenolol, etc. decreases the blood pressure and heart rate. Statins. These drugs reduce blood cholesterol level. They also help stabilize and prevent the rupture of atherosclerotic plaques, reduce the blood vessel inflammation, and decrease the likelihood of an infarction. Other anti-anginal agents are calcium channel blockers, relaxes the muscles of coronary arteries, and mitigate the effect of obstruction and spasms. Now we will look into angina. What is angina? Angina is a chest pain or discomfort caused when your heart muscle doesn't get enough oxygen-rich blood. It may feel like pressure or is squeezing in your chest. The discomfort can also occur in your shoulder, arms, neck, jaw, or back. What are the causes of angina? Angina is usually caused by the artery supplying blood to the heart muscles becoming narrowed by a buildup of fatty substances. This is called atherosclerosis. There are three major types of angina. Stable angina, which is the most common type, it happens when the heart is working harder than usual. Unstable angina is the most dangerous. It does not follow a pattern and can happen without physical exertion. Variant angina is rare. It happens when you are resting. What are the symptoms? Angina symptoms include chest pain and discomfort, pressure, squeezing, burning, or fullness. Now, what is the treatment? How can we treat or cure our angina? Your treatment will depend on the type of angina you have and other factors. If your angina is stable, you might be able to control it with lifestyle changes and medicines. Unstable angina requires immediate treatment in a hospital, which could involve medicines and surgical procedure. So as we have discussed above, the surgical procedure, which is coronary angiography or a coronary catheterization, this would be helpful in treating the angina. It is an invasive test used to visualize the coronary arteries. Cardiologists who specialize in hemodynamics will carry out the test, which involves puncturing an artery in the arm or groin and then inserting a catheter until it reaches the coronary arteries. A contrast agent is injected through the catheter and fills the inside of the blood vessel. X-rays are used to capture images of the artery from different angles, which together with the contrast agent help create a general picture of the obstructed area. The resulting images are like a mold taken from the inside of the artery. After examination, the catheter is removed and a very strong compression applied to the punctured artery where it was inserted to prevent heavy bleeding, since blood flow through arteries at a higher pressure than veins. The patient must wear compression bandaging for 12 hours and can start walking after 24 hours. The risk of complication is low. The most typical problem is bruising as a result of puncturing the artery. Not only does coronary angiography provide important information for the diagnosis of ischemic cardiomyopathy, but it also offers a view of the blood's passage through a coronary artery, which helps determine the treatment. So this was the angina. Now we will see the anti-ischemic drug therapy, the drugs which we use to treat the ischemic heart disease. We use organic nitrates. Nitrates also promote coronary vasodilation, and nitrates are commonly used in the treatment of anginal syndromes. They are effective in treating all forms of anginas because they decrease venous return to the heart and therefore decrease the cardiac work. Even in the presence of atherosclerosis, nitrates generally are well tolerated. To prevent the loss of effect over time, however, they must be scheduled to provide a nitrate-free interval of 10 to 12 hours. The organic nitrite of amyl of nitrite was initially used as a therapeutic agent in the treatment of angina pectoris in 1867, but was replaced over a decade later by the organic nitrate nitroglycerin due to the ease of administration and longer duration of action. We will see what is the mechanism of action of nitroglycerin. Similar to other nitrates used to treat inguinal chest pain, nitroglycerin convert to nitric oxide in the body. Nitric oxide then activates enzyme guanylyl cyclase which convert guanosine triphosphate to guanosine 3,5 monophosphate in vascular smooth muscles and other tissues. Now, CGMP then activates many protein kinase dependent phosphorylations, ultimately resulting in the dephosphorylation of the myosin light chains within smooth muscle fibers. This activity causes the relaxation of the smooth muscles within blood vessels, resulting in the desired vasodilatory effect. Now, what are the drugs we use in angina pectoris? There are three kinds of drugs: vasodilators, cardiac depressant, and other drugs. Vasodilators have two types: nitrates and calcium blockers. Nitrates are further classified into short duration, intermediate duration, and longer duration. Cardiac depressant classified into calcium blockers and beta blockers. Other drugs are metabolism modifiers, rate inhibitors. First of all, we will look into the administration of nitroglycerin. So first type is short duration, which we provide sublingually. Nitroglycerin is most commonly administered as a tablet that is absorbed sublingually. It is given in hospitals as well as prescribed for outpatient use. Patient may be prescribed nitroglycerin to take as prophylaxis for inguinal chest pain prior to an event that may provoke inguinal symptoms. There currently are three doses available: 0.3 mg, 0.4 mg, 0.6 mg. The dose is repeated after every 5 minutes until the achievement of relief. If inguinal pain persists after 3 doses, prompt medical attention is required. Nitroglycerin is primarily eliminated via metabolism in the liver and has a mean half-life of approximately 2 to 3 minutes. Then the second type is intermediate duration, which we give IV, means intravenous. There are intravenous routes of administration for nitroglycerin used most commonly in emergency rooms and ICUs. It is administered as a 5% dextrose in water drip and is indicated when a sublingual nitroglycerin has failed to provide symptomatic relief or if rapid or continued relief of symptoms is necessary. The drip is frequently used to treat acute coronary syndrome, hypertensive emergency, and acute congestive heart failure. When administered, its effect requires tight monitoring as discussed below. Third and last is transdermal duration. Transdermal means longer duration. Transdermal methods of nitroglycerin administration are most commonly administered in emergency rooms during acute angina attacks. It is a 2% ointment that is applied directly to the patient's skin and allowed to absorb. It is typically for patients that cannot tolerate the sublingual administration of nitroglycerin or have a previous adverse reaction to the sublingual tablets. Absorption takes about 5 to 10 minutes for full effect. The ideal application is on the surface with minimal amount of hair as it can inhibit absorption, and care is necessary to not apply repeatedly to the same area if multiple doses are required. Repeated application of the ointment on the same area can cause skin irritation and dermatitis. Transdermal patches are also available at varying doses per hour: 0.1 mg, 0.2 mg, 0.4 mg, and 0.6 mg, but these are rarely used and reserved for angina prophylaxis only. So here we are done with the nitroglycerin. Now we will look into the chest pain because our patient Mr. JP is suffering from chest pain. So we will see what chest pain is. Chest pain appears in many forms, ranging from a sharp stab to a dull ache. Sometimes chest pain feels crushing or burning. In certain cases, the pain travels up the neck into the jaw and then radiates to the back or down one or both arms. In the picture here, we have described the location of chest pain. So chest pain can occur in many different locations. Many different problems can cause chest pain. The most life-threatening causes involve the heart or lungs because chest pain can indicate a serious problem. It is important to seek immediate help. What are the causes of chest pain? So, chest pain has many possible causes, all of which need medical attention. We will discuss what pericarditis is. This is the inflammation of a sac surrounding your heart. It usually causes sharp pain that gets worse when you breathe in or when you lie down. What is heartburn? This painful burning sensation behind your breastbone occurs when stomach acid washes up from your stomach into the tube that connects your throat to your stomach. Then what is angina? Angina is the term for chest pain caused by poor blood flow to the heart. This is often caused by the buildup of thick plaques on the inner walls of the arteries that carry blood to your heart. These plaques narrow the arteries and restrict the heart's blood supply, particularly during exertion. What is MVP? MVP is also called mitral valve prolapse. It is a condition in which two valve flaps of the mitral valve don't close smoothly or evenly but bulge upward into the left atrium. Mitral valve prolapse is also known as Click-Murmur syndrome, Barlow syndrome, or floppy valve syndrome. Many people with this condition never have symptoms. When diagnosed, people may be surprised to learn that they have a heart condition. Now, what are the symptoms of chest pain? Chest pain can cause many different sensations depending on what's triggering the symptom. Often the cause has nothing to do with your heart, though there is no easy way to tell without seeing a doctor. There is the pressure, fullness, burning or tightness in your chest, crushing or severing pain that radiates to your back, neck, jaw, shoulders, and one or both arms. Pain that lasts more than few minutes, get worse with activity, goes away and come back or varies in intensity. Shortness of breath, cold sweats, dizziness or weakness, nausea or vomiting. So they were the symptoms of chest pain. Now we will see our case study, which is the most important part. Our case study is, during the first hospital day, JP decides to walk up 3 flights of stairs and returning to his room from the cafeteria instead of taking the elevator. Midway through the flight of the stairs, JP developed a chest pain. After quickly performing a 12-lead ECG, the physician instructs JP to place a 0.4 mg sublingual NTG tablet under his tongue. This relieves the pain. JP physician elects to continue metoprolol and add both short and long-acting nitrates. What is the mechanism by which NTG relieves angina, and why should JP continue his metoprolol therapy? We will make the soap notes first. First is subjective. His age is 62 years old, his height is 5'10", his gender is male, his weight is 235 pounds. His history is he is suffering from hypertension for 10 years, diabetes for 4 years, and traumatic amputation of right hand. Current medication which he uses is metoprolol 100 mg every day, glipizide 5 mg twice daily, and losartan 50 mg every day. He is allergic to sulfa drugs. Now objectives. His vitals are BP 164, 98 mm of mercury, regular pulse 73 beats per minute, respiratory rate 12 breaths per minute. We have done his laboratory test and it shows the following results. Hemoglobin content 43.5%, white blood cells count 5000, sodium 140, potassium 4.7, magnesium 1.9, random blood glucose 152, blood urea nitrogen 27, and serum creatinine 1.4. What is the assessment? Mr. JB is suffering from chest pain. He drinks 2 or 3 beers per day and does not smoke or chew tobacco. He consistently eats at fast food establishment, with his favorite meal consisting of 2 cheeseburgers and french fries. The physician performed his ECG and instructed him to place a 0.4 mg sublingual nitroglycerin tablet under his tongue. This relieves the pain. What is the mechanism of nitroglycerin? How nitroglycerin works? Nitroglycerin works by relaxing the smooth muscles and blood vessels in your body. This increases the amount of blood and oxygen that reaches your heart. In turn, your heart doesn't work as hard. This reduces the chest pain. And we have described the nitroglycerin mechanism before also. What is the plan? What will we do? JP noted substernal chest pain brought on by lifting heavy objects or walking uphill. He described a crushing or vice-like pain. When JP stopped working, the pain subsides in about 5 minutes. The dose of nitroglycerin which we will give to Mr. JP is usually 0.4 to 0.6 mg sublingually. The duration of time is 10 to 30 minutes. Sublingual we will use most commonly because it is the most effective one. And if the sublingual tablets does not work, then we will go to the intravenous or transdermal patches or these things. So in the question they have asked that why should we continue metoprolol? Metoprolol should be continued in JP because it both lowers the BP and exert anti-anginal effects. Metoprolol will provide continuous protection from ischemia during this time. And they have asked us to the addition of long-acting nitrates and short-acting nitrates both. So what the long-acting nitrates and short-acting nitrates will do? The addition of long-acting nitrates will provide JP additional protection against developing angina. And short-acting nitrates, what they will do? Short-acting nitrates NTG will provide JP acute relief when an anginal attack occurs. So this was the case study, and this was the Mr. JP who was suffering from chest pain. And what we will do to relieve his chest pain, we will instruct him to place a nitroglycerin sublingual tablet under his tongue for 10 to 30 minutes, and it will give him some relief. So that's what we have done. This was our case study, and thank you.